Duncan, and I'm the immediate past president of the T. Leroy Jefferson Medical Society. And welcome to the Health and Science Career Symposium. Now, for those of you who don't know, T. Leroy Jefferson was the first African-American doctor here in Palm Beach County. Some 100 years ago, he would do his rounds to take care of all of Palm Beach County citizens on his bicycle and provide that care. And so some 70 years ago, our medical society was born to honor him. It's the doctors, dentists, pharmacists, and other folks throughout Palm Beach County who felt there was a need to provide health care and advocacy for the medically underserved, guidance and mentorship for youth, as well as professional development for our members. And so that's what we've been carrying on for the last 70 years. Our members spend so much time going to classrooms and lecturing and talking to the future of healthcare, which is right here in the room. And we thought that how can we do this more efficiently and how can we amplify our effectiveness? And so from that, some 5 years ago, was born this career symposium idea. And boy, has it blossomed. We really here have overflow standing room only folks and more buses on the way. We're really blessed that you guys decided to come here and gain all this knowledge instead of sitting and watching cartoons on a Saturday. So we definitely appreciate you guys coming here to get smart. We're very happy. And also we're very appreciative to all of the exhibitors who've taken time away from their families and their careers to come and instill and impart that knowledge into you young folks here. They do it because they care and because they want to make a difference and they want to see you strive and achieve even bigger objectives than we have in our respective careers. I want to give some personal things to a number of different people, not only to our donors and volunteers and our staff, but just a very short list of some of the wonderful contributors to this event. The Quantum Foundation has been a bedrock. Southeastern University, Wells Fargo Foundation, Wellington Regional Medical Center, Sheridan Health Corp, Johnson & Johnson, the list goes on. There's over 35 different exhibitors here to stimulate your guys' minds and to show you that with or without a stethoscope, you guys can still be involved in healthcare. So some very important knowledge for you guys to obtain here today. On a personal note, I want to thank my beautiful and wonderful wife, Lisa Corey, and my kids, right over there, for their unwavering love, support, and understanding when I have to balance the endless meetings and planning sessions and fundraising activities instead of being able to attend their soccer games or, family fun. So they've sacrificed for the effort too, and I definitely love them and appreciate that. If we think about it, we are blessed to live in a wonderful country with a lot of great things happening and a lot of opportunity, but one thing that still is a challenge for us are healthcare disparities and educational gaps. There have been a couple of reports that came out recently that talk about, our 4th and 8th graders in the United States continue to be behind countries such as Finland, Northern Ireland, South Korea, Singapore, Taiwan as being top performers in math, and we're 10th as far as 8th grade performance in math, and 8th grade science we're even lower. So our kids, you guys, are the superstars, but as a whole in the nation, we're shying away from those tough programs and careers, but those are the ones of the future, the science, the technologies, the medicine, Those are recession-proof and growing fields. And so you guys are smart to be in them, but we really have to challenge ourselves to get even better about that. And truly, that disparity is even bigger amongst the historically underrepresented folks or communities of color within our community. The graduation rates at high school and professional degrees being allotted to our community is disappointing. And the question is, who is going to be around to provide that special culturally competent care to all the patients who are really in need? It tends to be people who are learned, and it doesn't even matter the color, but that are tuned in to cultural competence and that different cultures do things different ways. And to be a better provider, you have to be in tune with that and sensitive to those things. And innately, many of you have those capacities, and so you really need to utilize those attributes to help your future patients. I continually talk about the importance that the next millionaires, here in town, in this community, aren't going to be made by playing football or basketball or, the next iPad app or something like that. It's really through, education and your classwork and having a solid career like those in medicine, you can do very well economically and have a fantastic life and career, and also give back to those around you and make a difference. How many of you guys know about the stock market and how it works and what, okay, everybody has a general idea. We're over 20,000 now, and things are going well, but let me give you a wonderful analogy. You put your money in and it grows over time, and then later on you get to reap the rewards of that. But education is also like the stock market, and even more so. And to quote the illustrious Coach Hansel Tootie Toops, education is the surest stock on the market. It is the only way that you can invest your time in early years to be certain to receive lifelong returns. So if you think about that, that's a very powerful statement. Coach Tooks' son, Hansel Tooks II, is over here in our audience. He's going to be talking to some of his students individually. So anyways, with that, without any further delay, I wanted to introduce one of our key supporters here, and that's Mr. Eric Kelly, who is the President and CEO of the Quantum Foundation, who helped underwrite this wonderful event consistently for all 5 years. So demonstration of gratitude, and his wonderful son is joining him too. Eric Kelly.
Good morning, guys. Good morning, everybody. Good to see you all here. I have one job, and it's to introduce one of the most important positions here in the state of Florida, the Florida Surgeon General and Secretary of Health. This is my son, Mason Kelly, my wife. I have 4 children, Madison, Mason, Miles, and Malachi. And my oldest and our oldest son hanging out with me. I'm going to ask you guys to do something this morning, though. I'm going to ask you to do something. I'm going to ask you to listen. You'll have plenty of time to talk with your peers throughout the day. But when Dr. Phillip comes up this morning, I'm going to ask that you not speak at all. Simply listen. You have one of the most important and highest ranking officials in the state of Florida with you today. She made a special trip to be here. So I'll ask that you give her your undivided attention. Undivided. Before I introduce Dr. Phillip, I do want to introduce and just acknowledge Dr. Alina Alonzo, because Dr. Alonzo is the local health department director And so I want to make sure that we recognize you, Dr. Alonso. Thank you. Dr. Alonso is instrumental in bringing Dr. Phillip here with us this morning. So allow me, please, if you will, to introduce Dr. Celeste Phillip. She was appointed by Governor Rick Scott as the Surgeon General and Secretary of Health for the Florida Department of Health in May of 2016. Dr. Phillip, who is a board-certified physician in family medicine as well as preventive medicine, also holds a master's degree in public health. Dr. Phillip was recently named the 2016 Outstanding Public Health Woman of the Year by the University of South Florida's College of Public Health. She is the president of the American Heart Association's 6th-state Greater Southeast affiliate and previously served as the Centers for Disease Control and Prevention, or the CDC, as the Epidemic Intelligence Service Officer and Preventive Medicine resident. By way of education, Dr. Phillip graduated from the Howard University. Washington, D.C., magna cum laude. For those of you who have not heard that term, it's Latin. There's magna cum laude, summa cum laude, and here's the one I need you to stay away from. Thank you, Lord. Because thank you, Lord, simply means I bear the God. So we don't want any thank you, Lord. Right? Magna, cum laude, and Lord. You got that, right? Stay away from thank you, Lord. She graduated with a Bachelor of Arts in English and in Spanish. She later received her Master of Public Health in Maternal and Child Health and a Doctor of Medicine from Loma Linda University in California. Ladies and gentlemen, listen again. This is the person you want to hear from. Undivided attention. Resist the temptation and the urge to speak while she is speaking. Will you give a rousing round of applause and help me welcome Dr. Celeste?
Thank you. I feel like I just won an award or something, that kind of applause. How's everyone doing? So I appreciate Mr. Kelly's comments about paying attention, and I promise I will not speak too long because I'm with you. After a few minutes, 10, 15 minutes, we start to get antsy. So I'm going to keep my comments short. I'm going to ask some questions where I actually want you to give me your answers. And then I'm going to leave a few minutes for you to ask any questions that you want. Okay, I'm going to start out with my first question. Can someone tell me what is the most important factor for your health? Like if I could pick one thing to say how healthy I think you are or aren't, what do you think it would be? Just yell out some answers. Nutrition. Lifestyle, diabetes, okay, I heard lifestyle, nutrition, diabetes, high blood pressure, exercise, okay. Mental health, good, okay. So those are all very good answers. And those are all important, and for those of you who are considering a career in health, any one of those areas is important, and if that's what you want to do, you will make a difference. But you might be shocked to hear that the answer is actually your zip code. Yes, and this is what public health is about. Where you live right now in the U.S. will predict what your health is like if you're not able to change some of the elements in your environment. That's pretty shocking, isn't it? We know that there's been a lot of studies that say that healthcare is about 20% of what makes you healthy, and the rest is where you live. We heard a lot about lifestyle. That's definitely true. Other factors such as how much sleep you get, how much stress you have in your life, for different reasons, that impacts your health. As you start to study more, as you get further along in your career, you might learn specifically how having chronic stress, for example, can affect your biology. It causes your stress hormones to stay elevated, and stress hormones are important for your metabolism and your overall regulation, but they're supposed to be elevated only at certain times. When they stay high all the time for different reasons, and we all feel stressed out. I know probably there's some days you have to take an exam, or there might be something going on in your family or with your friends, and you feel stressed. There are some of you in this room, family members, your parents, people that you live with, you probably know that they have high stress all the time. And I'm here to tell you that that is probably one of the factors when we say zip code that is related to your health, because where you live sometimes can be stressful. So I just want you to keep that in mind, because that doesn't mean that there's not answers, that there's nothing that we can do to change it. But within healthcare, within public health, within other health-related fields, we have opportunities. But no matter what you do, whatever you choose as a career, you have to remember to give back to your community. If you live in one of those communities now where you know there are challenges, if you know that you don't have access to fresh fruits and vegetables, that you have a supermarket that you have to take 2 or 3 buses to get to, and the only food that you have access to, and I heard nutrition a lot, so you all know how important it is what you eat. You probably, and I'm not judging anyone, but you probably, some of you here, some of your friends, the only place you go to get food is probably a gas station or a convenience store. And what are your options there? Usually it's potato chips, soda, candy, right? Skittles, there you go. So one of the things that we've been working in public health is how to address something like that. And throughout the state of Florida, we have partnerships to bring to those locations some fresh fruits, some healthier options to eat. Some of you may have seen that now there are healthier sandwiches, for example, in some gas stations. And that's a very deliberate effort to try to bring more access to healthier foods in every community, because that's what it will take for all of us to become healthy. So I wanted to just share that as an insight into what public health is, because that's what we do. We look to see what are the things in communities, what are some of the different characteristics that we know are creating difficulties for people to be healthy. And think about some of the people in your life who have to, again, make those long trips for access to better foods for you, and we know they're also more expensive. So it's not always easy, and in public health, we're trying to break down those barriers. So some of you might be thinking, what exactly is a Surgeon General? I still don't really know the answer either, but some people might say that my responsibility is to serve as the state's doctor for any questions that come up that are impacting the whole state. Have any of you heard of Zika? So I spent a lot of time in South Florida last year because of Zika and the impact that it was having in Miami, which is just your neighbor south of you. And a lot of what I did was to try to help educate the doctors in the community, all of the nurses, the other medical care providers, to know what the signs and symptoms are, to know the risk factors. How did we get Zika? Mosquitoes, very good. How else? Sex, very good, that's right. So there's lots of good reasons to abstain or to use protection, and Zika is another example. But you see how all of you knew mosquitoes, but only a couple of you that it can be sexually transmitted as well. So that's something that we are working on to make sure that everyone understands that. During that time where Zika was just coming to the attention internationally, and then we started seeing cases in Florida, I spent a lot of time, like I said, traveling to South Florida, to Miami. I spent a lot of time with our Governor Scott, to emphasize how important this is, but to also come up with solutions. We spent a lot of time working with hospitals and clinics and communities to make sure they knew how to protect themselves. How do you protect yourselves from Zika? What are some of the things you can do? Repellent, okay, condoms. We're about to get rid of mosquitoes around your house. What do you have to do? Okay, cover, drain and cover. Okay, very good, that's right. This is very informed group. I'm glad to see this. So Dr. Duncan talked about health disparities. Does everyone know what that means? Okay, one person, raise your hand so we can hear you. Right here. Yes, you right there. What does health disparities mean? Very good. Some people in one area might be less healthy than people in another area. That's absolutely right. So I will go back again to zip code and the concept that place matters, because we oftentimes think, well, it's because I'm a certain race or ethnicity, or it's because I look a certain way. But a lot of it is because those of us that look a certain way, we all live in the same communities, and those communities have those same characteristics or potentially stressful factors that I mentioned. So as you think about your career and what you want to do, I encourage you to keep that in mind, because when you try to talk to someone about changing their diet, being more active, taking their medications for diabetes, for blood pressure, for cholesterol, even when it comes to infectious diseases sometimes, such as tuberculosis, which I know we don't hear that much about, but when we do see it in communities, it tends to be in communities that have fewer resources, that have the same kinds of challenges. And we, in public health, start to look at the community as our patient rather than each person. And that way we can help improve the health of neighborhoods and hundreds and thousands of people when possible. Are any of you in a SWAT team? Does anyone know what a SWAT team is? Not the kind that goes and breaks into people's houses, or... Do you know the SWAT team? What's a SWAT team? Very good! Students working against tobacco. I don't know what that means, but okay, it's clapping, good. You have the opportunity right now to be a positive influence on your friends, people in your neighborhood, classmates, and SWAT is one of the examples. We know that tobacco, besides zip code, tobacco is one of those other high priority factors that we can affect. If you use tobacco products, especially if you start when you're young, and most people do start in their teen years. If you use tobacco young and continue it over your lifetime, it can lead to many different health conditions that we've already talked about, and poor health, poor quality of life. If you start now and commit and say, I'm not going to experiment, I'm not going to fall into that trap, and you talk to others about it, that's public health. That is you using your influence and your knowledge to affect many different people, and it may be one-on-one, but over time you're affecting groups of people. And if we can all do that, and tobacco is just one example, but it's one that's important because it is such a common time to start experimenting when we're young. And nicotine, which is the addictive property in tobacco, is one of the most addictive properties that there are in anything that we're exposed to, and that's why it's so difficult to quit. But we do have ways of quitting, and in Florida we're fortunate through our health departments and through other programs. We have different ways to help people quit through a website, through phone calls, or in-person classes. And through that way of interacting, people decide which way they think is most appropriate for them. They are able to have assistance to quit smoking. So that, again, you right now have the opportunity to be that positive influence. I'm going to wrap up with just a couple of things for you to think about besides what I already mentioned, and then I'm going to open up for questions. This kind of role for me is not something that I sat down when I was your age or even a few years ago and said, I think I want to run the health department or be the state surgeon general. But I love public health. I do my best to work hard, and opportunities have presented themselves to me. If you had asked me when I was in high school what did I think I was going to do, well, the first thing I wanted to do was to do hair. That was the first thing I wanted to do. But after I realized maybe that wasn't a good option, I was introduced to medicine at an early age. I was about 15 when I started interacting with doctors. So I encourage you first, work hard, take advantage of opportunities, that includes volunteer opportunities, because you never know how one person can change your life. And you might be thinking, well, I live in a neighborhood that I know is difficult, that a lot of people in my neighborhood are not that healthy. But all it takes is for one person to give you an opportunity to be exposed to a program, a training program, a job, or someone else that can help you fulfill your dreams. And hold on to your dreams, but maybe not exactly the pathway, because I thought I was going to do several other different things. And when those things didn't happen, I was disappointed. And I thought, oh my goodness, I've been working so hard, and I don't understand why I can't get out of this place. I was ready to leave Florida. I love Florida, but at the time I felt very stressed out and thought I was getting ready to leave. And then this opportunity presented itself to me, and I would have never imagined it, but it truly has been the greatest blessing for me thus far in my life. So I just want all of you to think about that and to not be discouraged if something you thought was the right thing for you to happen in your career, you thought it was the best thing that was going to happen to you. Sometimes there are other things that are even better around the corner, and you just have to hang in there, be patient, and continue to work hard. The last thing I want to say is, when you are successful and when you are living your dream, whatever that is, in the healthcare field, public health, putting a plug for public health, research, whatever it is that you are doing, to remember that part of the blessing of wherever you are is to reach back and to help others, to provide mentorship. We have a lot of professionals here who are successful, and they care enough. I mean, this is the weekend. They could be out on the beach or all the fun things there are to do in South Florida, but they're here today because they're reaching back to you to say, I can do it, I did it, and you can do it too. So remember that, because that is how we lift up communities and neighborhoods, is by the few of us who are able to reach back and provide that kind of leadership, mentorship to others. That kind of connection, we heard about how important mental health is, that makes a difference in people's lives, and that within a community can be a catalyst for change. So I'm going to wrap up now, and I want to take a few minutes for any questions that you may have. And I think there's a mic up here. Can we use this mic, or?
What's a typical day like as a surgeon general?
Very good question. There is no typical day, but a lot of what I do is meet with different groups who have concerns or ideas about how to make their communities healthier. A lot of times I spend traveling around the state to talk to different groups. I love talking to students because you all ask the best questions. That last question, never been asked before, caught me off guard. But a lot of what my role is to try to help connect people to either work together, to existing resources, so that we can help make communities healthier. That's a lot of nice of my time doing.
Yeah, this is your man right here. I think we'll just take these last three questions out, Doctor. Just these three, okay. Let's listen up, guys.
How you manage doing your job and schedule?
I keep a very busy schedule, and it is difficult at times. But another point for all of you is that you have to make time for yourself. So I love yoga and running. I try to make time as much as possible when I travel to build it into my day. Yoga I love because you can do it in your hotel room, you can do it anywhere that you travel. Running sometimes is a little bit harder. But I have a team that I work with at the department that helps keep me going and keeps me on track. But it is difficult. Many of us are busy. You probably know how busy your parents are too. And it's a skill that you should be working on while you're students to manage your time. Thank you.
Hey guys, we have two more questions. Remember what I asked earlier. Listen up, listen up. We have two more questions. But I want to ask you to do again, undivided attention. Undivided attention for the last two questions and response.
What's your favorite part about your job?
I feel like I have the opportunity to help everyone in our state be healthier. And that's a lot of responsibility, but it also brings me a lot of reward when I feel like I'm able to do that. What are the obstacles that you face as being a general surgeon every day? What are the obstacles? I remember when I was in school, and those of you who maybe can relate to this, when we learn about our elected officials, about how bills become laws, I wasn't that interested back then, and I didn't ever see myself being in a political situation. But this kind of job, the governor is my boss. I interact with our state legislators. I've gone to DC a couple of times to talk with Congress and US senators, and it is very political. So I would encourage all of you, even if you don't work in a job like mine, if you are a licensed health professional, there are boards that regulate your field, and that's how you get your license. Those boards, you can become a member and participate in that process because you might be surprised how much the law affects how you practice. You think, well, I'm just taking care of people and it's about doing the right thing and what's the best thing for that person's health, what's the right treatment, what's the right medication, therapy. But a lot of it is determined by the law. And when you are on the board, you have an opportunity to provide feedback and impact and create rules for your profession. You interact with legislators, and again, that's probably the most challenging part, because in health, you think there shouldn't be politics, but health is oftentimes driven by people that we vote for. So it is very important that as soon as you're old enough, you register and you vote at the local level, at the state level, as well as the national level. Because everything we do is driven by people who are in office, and sometimes, especially when you're younger, and I remember I had no idea how important that was. So I'd say that's what's most challenging.
I'd like to have all the TLJMS Jefferson Medical Society members come to the stage. We want to acknowledge and thank the Surgeon General for taking time out of her very busy schedule, keeping us all safe and healthy, and providing all this knowledge to all of these students. And as a token of our appreciation, we have this little memento for her. And if you hold this, let me read. This is to Dr. Celeste Philippe, MD, MPH. Thank you for inspiring our next generation of healthcare and science professionals. T. Leroy Jefferson Medical Society, February 25th, 2017. So we thank you.
Thank you. Fabulous. Thank you so much.
We appreciate her words of wisdom and her taking time out to inspire us all. And we're just about to kick things off after we take the pictures and hear some words from our president, Dr. Osiami. But first we'll take a couple of pictures. So thank you guys for your indulgence.
My name is Dr. Ashimi. I'm the current president of TLJMS Medical Society. I'm an infectious disease specialist. You hear Dr. Philip mention Zika virus. Those are the kind of things I take care of. Zika virus, HIV, hepatitis. That's a very interesting field. So if any of you here want to be an infectious disease doctor someday, you can give me a call. I also want to thank everyone for coming today. On behalf of T. Jefferson, again, thank you so much for being here. For some of the old folks, friends that I've seen that I saw out there this morning, please join T. Jefferson, pay your dues. We need you out there. All this work that we've been doing for years, we need more people, we need more involvement. So before you leave today, please see Pablo or Quinn or any of the board members and pay your dues. And for you kids out there, think about what you've heard today. Dr. Duncan, Mr. Kelly, and Dr. Philip, they gave you some really good information. Don't let that information just be forgotten once you leave here. You need to go home and think about it. And even though we're having this symposium today, this is not the end of the interaction you're going to have with us. That means if you need to have a mentor, you need someone to help you with anything, give us a call the organization. We can link you up with somebody if you're interested in pharmacy, medicine, anything at all. Do not hesitate to call. Don't let today be the last time you reach out to us. Okay? On that note, I think we have a few things to do out there. There are plenty of us. We're going to be all stationed in different areas. Please try to attend as many as you can. Ask the right questions, all the questions you may have. No question is stupid, okay? Ask all the questions, all right? Now, I want you guys to thank Dr. Philip for a job well done today. I also want you to thank Dr. Duncan. We can do better than that. All right, thank you.
It was an honor to participate in the T. Leroy Jefferson Medical Society Annual Career Symposium with over 800 enthusiastic students who are considering what pathways they want to consider to have a career in health, and hopefully some will choose public health. I was very inspired by their energy and their enthusiasm and look forward to seeing the fruits of their success as they continue down their educational pathways.